Sex drive can rise on Wegovy or Zepbound, then fall after a dose increase. Wegovy contains semaglutide, while Zepbound contains Tirzepatide, and both suppress appetite. Libido responds to more than weight. Weight loss may improve blood flow, hormones, sleep, and confidence. Nausea, fatigue, and eating too little can reverse that benefit, so timing usually reveals the likely cause. These drugs make the brain feel full sooner and slow food leaving the stomach. This creates a calorie deficit, meaning the body gets less food energy than it uses. Sex drive can fall when the body is not getting enough energy. Libido means sexual interest. It is separate from erections, lubrication, orgasm, and pain during sex. A person may still want sex but struggle with physical performance. Another person may function normally but have almost no interest. Those patterns point toward different causes. A changing sex drive does not automatically mean Wegovy or Zepbound directly damage sex hormones. Changes in sex drive were not listed among common side effects in major weight loss trials. Those trials did not capture every change in desire or orgasm. Improvement often appears gradually. Weight loss can help the body respond to insulin and improve blood flow. It can reduce joint strain and ease sleep apnea, repeated breathing pauses during sleep. Better sleep and movement restore energy. In some men, weight loss can raise previously low testosterone. Confidence can change before laboratory results do. Less breathlessness, better fitting clothes, and reduced embarrassment may make intimacy feel easier. Sexual desire is shaped by body comfort, mood, feeling safe with a partner, and physical health. The drop pattern looks different. Desire falls soon after starting treatment or increasing the dose. Nausea shortens meals, constipation causes discomfort, and fatigue replaces activity. The person may lose weight quickly, but also stop eating enough protein, fluid, and total food. That creates two very different patients on the same medicine. One loses weight steadily, sleeps better, exercises more, and feels more interested in sex. The other loses weight while feeling cold, weak, nauseated, and mentally flat. The scale cannot separate those outcomes. A dose increase is especially revealing. If libido drops within days, and nausea or exhaustion rises at the same time, the dose may be indirectly responsible. If desire improves after the stomach symptoms settle, the problem was more likely poor intake and recovery than permanent sexual dysfunction. This problem is easy to miss because appetite suppression can feel like success. The missing hunger does not prove the body has enough energy, protein, minerals, or fluid for normal function. Low sex drive alone cannot prove that someone is eating too little. Look for changes together: fatigue, dizziness, feeling cold, weaker workouts, or poor concentration. Hair shedding, menstrual changes, or fewer morning erections add evidence. When several changes appear together after a dose increase, appetite suppression may be too aggressive. Faster weight loss is not always better treatment. A higher dose can improve the number on the scale while worsening sleep, strength, mood, and sex drive. The dose is too aggressive when the body is smaller, but daily function keeps shrinking. Low blood sugar can also cause an energy crash. Wegovy or Zepbound alone rarely causes it, but risk rises when insulin or certain diabetes pills are also used. Shaking, sweating, confusion, or sudden weakness needs a blood sugar check, because repeated lows can drain energy and reduce sexual interest. Other medicines can change sexual function. Antidepressants may reduce desire or delay orgasm. Finasteride, used for hair loss or an enlarged prostate, can affect sexual function. Opioids, strong pain medicines, can lower sex hormones, while some blood pressure medicines can impair erections. A new prescription may explain the timing better. Hormone problems should not be guessed from one symptom. Low testosterone, menopause, thyroid disease, uncontrolled diabetes, and sleep apnea can reduce sexual function. High prolactin, a hormone that can suppress sex hormones, is another cause. Testing should follow the pattern, because ordering every hormone creates confusing results. Not every decline is explained by hormones. Food, alcohol, shopping, and sex may all feel less rewarding. These drugs affect brain pathways involved in appetite and reward. Whether they directly reduce sexual pleasure remains unproven. When several pleasures fade together, the concern extends beyond sexual function. That wider pattern changes the evaluation. If sex alone feels different, focus on pain, performance, relationship context, and hormones. If nearly everything feels flat, review depression, sleep loss, severe calorie restriction, and other medicines. Different patterns lead to different next steps. A sudden drop with nausea calls for a dose and nutrition review. A steady improvement needs no special testing. A persistent decline without stomach symptoms points toward hormones, mood, pain, or other medicines. Start by separating desire from performance. Low desire means little interest or fewer sexual thoughts. Erectile difficulty, vaginal dryness, pain, or delayed orgasm may occur despite normal desire. That distinction helps identify whether nutrition, hormones, blood flow, medication effects, or treatment for dryness or pain comes first. Next, compare the change with the injection calendar. Record the weekly dose, nausea, food intake, sleep, mood, and sexual symptoms for 4 weeks. Repeated symptom worsening after each injection is more informative than a vague memory that treatment changed everything. Then review the rate and quality of weight loss. Rapid loss with muscle weakness and minimal eating is a warning, even when body mass index or BMI remains high. Adequate protein, regular meals, resistance exercise, hydration, and a tolerable dose protect function better than chasing the strongest appetite suppression. Do not respond by stopping treatment suddenly or buying testosterone online. The safer move is to manage dehydration, constipation, nausea, and inadequate intake first. A prescriber may hold a dose increase, return to a previously tolerated dose, or investigate another cause. Testing should answer a specific question. Men with persistent symptoms may need 2 early morning testosterone measurements, not one random afternoon level. Thyroid, prolactin, blood count, and blood sugar tests are added when other symptoms suggest they are needed. Men with persistent erectile difficulty may need blood pressure, blood sugar, medicines, and heart disease risk factors reviewed. Erections depend heavily on blood flow. New erectile dysfunction can therefore be a health signal, not merely a bedroom problem or proof that a weight loss drug caused damage. The same careful review applies to women with persistent dryness, pain, loss of arousal, or orgasm changes. Menopause, pelvic pain, antidepressants, relationship stress, and low energy intake may overlap. Desire cannot recover reliably when sex has become uncomfortable, so pain and dryness deserve direct treatment. Beyond sexual symptoms, seek prompt care for severe weakness, fainting, repeated vomiting, confusion, or inability to keep fluids down. Those symptoms raise concern for dehydration, low blood sugar, or another medical problem. Sexual symptoms alone can usually wait for a scheduled appointment, but severe whole-body symptoms should not. Outside emergencies, the goal is not maximum weight loss at any cost. It is durable fat loss with enough strength, food, sleep, and emotional capacity to live normally. Sex drive is one useful signal of overall well-being, especially when it changes sharply after a dose adjustment. Wegovy or Zepbound may improve sex drive when better overall health, mobility, sleep, and confidence outweigh treatment burdens. They may lower it when nausea, fatigue, undereating, another medicine, or an untreated hormone problem dominates. The deciding evidence is the pattern, not the rumor attached to the drug. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice, consult your doctor.